Y'all, this story is jacked up to heck and back. This woman was forced to give birth to a baby alone in a jail cell. And it gets worse. A Kentucky woman who is in isolated pretrial detention was forced to give birth to a baby boy in a toilet in a Tennessee jail. Now there's a lawsuit being filed, luckily. 34-year-old Alicia Moulton is suing Southern Health Partners, and that's a medical provider for the detention center in Montgomery County. There are several identified and unidentified defendants in the lawsuit, and it's being filed in federal court. The lawsuit states that the staff deliberately showed indifference to the mother's suffering and her medical needs in jail. Just listen to this all. It also accuses staff and the medical provider of negligence, as well as due process violations. The baby is listed as a plaintiff and states that all the defendants violated his due process rights. Reportedly, Alicia was alone in her jail cell when she delivered the baby boy in a toilet. As a result of the toilet delivery, the baby suffered several infections, including an eye infection and a blood infection. So on August 19th of last year, 2023, Alicia was detained on a burglary charge. She didn't find out about her pregnancy until that Southern Health Partners tested her when she was detained. And she was tested while she was in jail, like I guess shortly after she was detained by employees with that company. It was stated that one medical evaluation that was related to the pregnancy test was done by a non-doctor healthcare worker, and that medical care did not continue for Alicia. She was never scheduled at any point for a doctor's evaluation or anything, and that is so messed up. The lawsuit states that the failure to schedule her for a prenatal medical evaluation by a licensed physician was especially wrong because of several reasons. Number one, she was unaware that she was even pregnant. Number two, she had been using opioids while she was pregnant. Number three, she wasn't sure the date of her last period. Number four, even her last period would have made her around 24 weeks pregnant. And number five, during her entire pregnancy, she was never medically evaluated. The lawsuit also stated that she was never given an ultrasound, even though the jail staff knew that she was pregnant. Then Alicia was allegedly left to her own devices. It was said that she was housed in medical isolation, where she spent 23 hours a day in her cell with 1 hour outside of her cell. It was said that she was housed in solitary confinement for the duration of her incarceration at Montgomery County at that jail. That was from August 19th to August 27th, which is the day she delivered the baby. And of course, then she was finally transferred to the hospital. Now, there are guidelines on how medical staff and doctors should treat pregnant inmates. They're in jail, I understand that, but they deserve treatment just like anybody else, and so do the babies, especially pregnant women, the babies. She also complained in the lawsuit that she repeatedly told jail staff that she was having contractions the morning she gave birth. She also told medical staff this. However, she was only looked at just briefly by nursing staff who said no contraction was observed. That's what she put in her notes. It was said that none of the nurses took her complaints about contractions seriously, but cautiously disregarded the foreseeable risk that she would soon deliver a baby, or could soon deliver a baby, and she did. So as a result of disregard to Alicia's claims, she ended up giving birth alone in her jail cell and in a toilet because no one would listen to her. Jacked up. Then the lawsuit said that 2 days after she gave birth, she went back to solitary confinement. The mother and child reunited 1 week later on September 5th, but you know, those very first few days are so important for the mom and baby to be together. She also stated they didn't listen to her about her drug withdrawal. And two, guys, keep in mind, she allegedly did not know she was pregnant, or hopefully she wouldn't have been doing the opioids. It was said at no time did any employee educate her about how to manage her symptoms of withdrawal from the drugs, nor was she ever given any medication to help with the withdrawals, which is contrary to doctor recommendations. They instead wrote that she refused detox medicine, which is not true because she was never even offered any, nor did she ever sign a refusal of treatment form. She is asking for compensatory damages for future losses, physical and mental pain, humiliation, discomfort, anxiety, fear, loss of enjoyment of life, loss of liberty, privacy and sense of security, and individual dignity, among other things. She is seeking punitive damages and attorney fees. Her attorney said that this case and this lawsuit raises serious questions about the incarceration of pregnant women, and I agree. I seriously hope they beat the heck out of this lawsuit and win whatever it is they're asking for, because this is wrong. Just because a woman isn't pregnant doesn't mean she doesn't deserve the care. Think about the baby. The baby definitely deserves to be evaluated while they're in the womb. Let me know what you think in the comments. And don't forget to give me a follow and visit www.truecrimewithmegan.com.